Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the basilic vein. The basilic vein is one of the major superficial veins in the forearm and arm. The basilic vein begins on the medial side of the dorsal venous network of the hand. So this is the dorsal venous network, and the medial aspect will have formation of the basilic vein course. It ascends along the posteromedial surface of the forearm, passes anterior to the medial epicondyle as it travels upwards toward the elbow. Termination above the elbow, it continues upward where it pierces the deep fascia that is called brachial fascia of the arm, maybe at the level of the mid-arm, maybe at the level of the upper 2/3 and the lower 1/3 junction of the arm, and joins the two brachial vein, the vena comitatus of the brachial artery. It also receives the vena comitatus of the profunda femoris artery and forms maxillary vein at the lower border of the teres major muscle. Relationship in the forearm, it is accompanied by medial antebrachial cutaneous nerve, also called medial cutaneous nerve of the forearm. In the lower half of the arm, it passes along the medial border of the biceps brachii muscle and is related to the medial cutaneous nerve of the arm. In the upper part of the arm, it is related to the brachial artery. It is connected to the cephalic vein via the median cubital vein at the roof of the cubital fossa. Clinical significance: basilic vein is used for venipuncture due to its superficial location. Basilic vein is commonly used for intravenous access, maybe to draw blood or to inject fluid or the medication or drugs. Okay, so but we always prefer this median cubital vein, but basilic vein is also a choice. Medical procedure: it may be utilized in procedures like the placement of a peripherally inserted central catheter, PICC line. Okay, so formation of basilic vein from the dorsal venous network along the medial border, and it goes posteromedially, passes anterior to the medial epicondyle. Okay, then it pierces the brachial fascia. It receives the brachial veins. The vena comitatus of the brachial artery also receives other deep vein like the vena comitatus of the profunda femoris artery. The lower border of the teres major, it becomes the axillary vein, and axillary vein at the outer border of the first rib becomes the subclavian vein that unite with the internal jugular vein, forms the brachiocephalic vein, and two brachiocephalic vein join to form the superior vena cava that opens into the right atrium of the heart. Okay, we got that. If we go to the second image, this is our basilic vein. It becomes the axillary vein. Okay, and axillary vein receives cephalic vein. Axillary vein at the outer border of the first rib becomes the subclavian vein, unite with the internal jugular vein to form the brachiocephalic vein, and two brachiocephalic vein join to form the superior vena cava that opens into the right atrium of the heart. So we got the paired brachial vein, also called vena comitatus of the brachial artery. And that's all about the basilic vein anatomy. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.